Hi, everyone. I'm Alicia Bronson, and my co chair is Victoria Baines, and we are the co chairs of this interprofessional special interest group. So, today we want to talk about what's been going on this year in our group and how we've been doing. So, getting started, what have we worked on this year? First, we've highlighted the role of nursing, counseling, and allied health. We want to change that to interprofessional as when we discussed at our meeting, it doesn't really fit anymore. So we've looked at the social media streams and trying to highlight these roles. And then understanding the CPS membership composition, we added some questions into the survey that got sent out to see how interprofessionals fit within the Canadian Pain Society. That'll really give us a bigger picture of how we can help you. And coming into 2025, we're looking at patient partners and highlighting these roles further. If you want to reach out and get involved, we would love that. Next, we wanted to share a case study. So before we get into it, I'm a registered clinical counselor and I work in BC and across Canada. My practice specializes in chronic pain, trauma, largely invisible illnesses, and I also happen to live with chronic illnesses myself. So the practice is really built on both professional experiences and lived experiences. So when I meet with clients, often it's the first time they've ever talked to someone else in pain, and especially a provider that understands what they're going through. So this is a recovery story. So today I'm going to begin with this story. I've been working virtually with two children, aged 9 and 10, and they became seriously ill in December. Their pain began in and around a 9 out of 10 daily. They have various symptoms, and their mom came to me really worried, unsure how to help them, unsure who could help. And she told me that they'd seen many doctors, felt pushed and prodded, and from their experience at Children's Hospital, they didn't know what to do anymore. The kids felt shy from other people now, and they kind of felt like guinea pigs. Often you do if you're in health. So, mom said that she had been told by the doctors that they didn't know what to do. They weren't sure what was wrong. The kids came away from the experience really shooken up. And mom started building a team for her kids. That included physios, acupunctures, and counseling. Both were later diagnosed with hypermobility disorders and cere- cerebrospinal fluid issues. Again, next time. And they both experienced high amounts of unrelenting body pain, migraines, nausea. They were also very dizzy and needed help walking. So for several months, they couldn't get out of bed, attend church, go to school, or even walk to the bathroom on their own without help. They became really isolated, not wanting to socialize with anyone outside of the family. And that piece was worrying for me as a counselor. If they didn't want to reach out to anyone outside of the family, it said that there was a lot more going on there. Case outcome, by April, just 4 months later, they were walking unassisted again. And as of last week, they're doing great. They're back to attending social gatherings, church. Both children's pain have dropped under a 3, and they're beginning to return to normal life. They're doing school again. They're enjoying going out with family. And they've actually attended church with a ton of people there and had no side effects. That was big for them. So we used a combined approach here. First, I started with teaching mom and the kids pacing. So we have virtual slides just like this. And I taught them how to use pacing to help their energy levels. We did some psychoeducation on how their bodies feel and how the symptoms are being affected. So online slides and sessions could be helpful for them. Then next we started with safe and sound. This is a really interesting one, and it's newer because it's based on Dr. Porges' neuroscience on polyvagal therapy or theory. And he has a couple books that are really interesting on how our nervous system is affected. And so the Safe and Sound protocol uses the middle ear muscle to the vagus nerve to calm and turn down the central sensitization. Then they started to show signs of improvement. So we started going into pain reprocessing therapy. We'd worked on the body and how our body felt. So next we were going out to our mind. How does our mind feel? What could we shift? So we started with helping shift their brain's interpretation of the pain signal. We worked on how pain and fear are linked and how they could use tools to shift the pain. So looking for exceptions. One thing we did was, how does your nose feel? Is there any pain in your nose? If there's pain in your body, where are the exceptions there? And keeping a list. When is the pain not present? Can we have a long list of that? What doesn't make the pain worse? Focusing on those things has helped. And so they worked on kind of cracking that pain fear link. And now these tools weren't just about managing symptoms, they're about helping the kids reclaim their lives and being able to go back into childhood, play soccer, go do things with friends. So, a lot of this we're talking about is reframing pain as a nervous system issue. Pain isn't always the result of tissue damage, or even when a physical cause is present, the brain and nervous system still play a major role in shaping how we experience that pain, especially when it's amplified by our stress, fear, and felt emotional threat. So studies show that 80 to 85% of chronic pain is maintained by the central nervous system, sensitization, or neuroplastic processes. So that's where the brain continues to send pain signals long after the initial injury is passed or alongside an ongoing illness. For myself, it's alongside. I have SUNA, which is a trigeminal autonomic cephalgia. And so I have the pain condition, but I have noticed that both um, safe and sound protocol and pain reprocessing have helped lower the feeling of it and help to change it when it's in the moment. In fact, often allied health are the professionals that first see patients. So this means that individuals living with autoimmune conditions like cancer, complex medical diagnosis can all still benefit from brain-based approaches to pain care. So long before they ever get to a pain clinic or a specialist, we can be helping them. And that's really big. While we may not be able to remove the root cause or cure the chronic condition, we can help reduce the brain's amplification of the pain signal. Through compassion, consistent care, we can support people in living more comfortably and function better and have hope even in pain. So the tools that rewire pain that we are discussing today are more counseling based. They're my work that focuses on three core approaches: pain education, safe and sound protocol, and pain reprocessing therapy. This helps clients manage energy, reduce crash cycles, rebuild tolerance slowly and compassionately. The listening based intervention helps support vagus nerve regulation, helps shift the system out of a fight or flight mode from danger to safety. And it's especially effective with clients with trauma, anxiety, sensory overload, and dysautonomia, as well as a lot of others. And the big thing with it is it works on all age groups. So I've used it with children as young as 3 and with older adults as well, up to 79. So pain reprocessing is another one. It's more cognitive and somatic effect, and it teaches pain retraining in the brain. So looking at how we feel when the pain comes up, building safety, reducing fear, rewiring our brain. So what I see in patients, often across age groups, diagnoses, I've witnessed a decreased fear of pain and flare-ups. So their flare-ups become less and less over time. They improve their nervous system regulation. There's greater mobility and energy control, and an increased ability to engage in work, school, play, a shift from survival to thriving. This is what we want for all our patients. So these ones don't just include um, access that's immediate, but they also don't have long wait times. Through virtual access options, we can help clients connect with someone, and it can be the first time they feel heard, hopeful, and empowered in their life. That's where the role of allied health comes in. And that's where counselors, nurses, physiotherapists, OTs, doctors, we all work together as a team. So each have a unique role in patient care, helping them regulate their nervous system, supporting recovery from pain with tools, and building sustainable routines that help them adapt. Addressing fear based avoidance with support, treating the whole person, not just the symptoms. But the key to unlocking the full potential of our care system is in referring to one another and ensuring that our clients are connected with the right professionals at the right time. Sometimes that can just mean getting someone from partner of interprofessional care into the picture before getting to the doctor. That can really support the doctor's care that someone's been working on. But also, it helps the patient feel like someone cares about them, they matter, and there's someone they can talk to throughout it. They can see their OT more weekly than they can a doctor. They can meet with a physiotherapist and feel a little bit better often. And so that's what we want, more referrals to each other and wider. So in Canada, we want to increase our collaboration because access to care can be really challenging. Virtual practices offer an opportunity to broaden allied health networks or interprofessional networks and reach a lot more people in shorter amount of time, especially helping in rural and underserved areas through the expanding of referral networks across disciplines using flexibility of virtual care. We can expand that reach of services. We can lower those wait times to care and address the gaps in our healthcare system. So, all in all, when we collaborate across professions, we offer something the system can't always provide on its own. That's consistent relationship based care, and it empowers healing. And when we do it together by creating interconnected networks, that empowers clients, clinicians, and the healthcare system as a whole. So that's it for our talk today. But the brainstorming part of it is we want to bring it online. So tell us in the comments, how do we make the work of nursing, counseling, and allied health more visible? How can us at the Interprofessional Special Interest Group help you? So thanks for watching. Bye for now.